Hello and welcome to Dr. Sushant's Anatomy tutorial. This is part 3 of a knee joint. In this part of the video, I will discuss the clinical anatomy of the knee joint. So first we will look at the plain X-ray radiograph of the knee joint. So in this particular radiograph, we see the condyles of the femur, medial condyle, lateral condyle, the condyles of the tibia, the medial tibial condyle, lateral tibial condyle. We see the head of the fibula, and most importantly, we see the superior and the inferior articular surfaces of the femur and the tibia. We also see the shadow of the patella here. We see the joint space also between the femur and the tibia. Now, when there is a disease of the joint, the joint space reduces. As you can see, this is the normal joint space, which is about 5 millimeters in females, and it is about 6 millimeters in males. Okay, I guess this is how we represent the females, right? So in females it is 5 millimeter, and in males it is 6 millimeters, the joint space. When there's decrease in the joint space, it indicates wear and tear of the joint. That could be due to the degeneration of the articular cartilages, right, as in osteoarthritis. So here you can see the space between the femur and the tibial condyles has reduced. So there will be rubbing of the articular surfaces against each other, and that will be a very painful condition. Now here is an important term known as the terrible triad or unhappy triad. So there are three structures involved in a knee injury. That was it is called triad. So this is very often asked in exams. Okay, this is an important knowledge. So terrible triad. So this figure shows the tear of the tibial collateral ligament. Okay, this is the tibial collateral ligament or the medial collateral ligament. The three most injured structures of the knee joint are the tibial collateral ligament, medial meniscus, and the anterior cruciate ligament. So these three structures together are known as the unhappy triad or the terrible triads of the knee joint. Now, if there is a blow to the lateral aspect of the knee when the foot is on the ground, this may sprain the tibial collateral ligament, that is a ligament on the medial side. So you can imagine placing the foot on the ground and it is semi-flexed knee, and you are being tackled on the lateral side. So you get a blow on the lateral aspect of the knee joint. So there is a forceful abduction of the knee joint along the medial side. So this will result in the tearing of the medial meniscus. So you have the femoral condyle, you have the tibial condyles. You say this is lateral, this is medial. So here is your medial collateral, the tibial collateral ligament. So when you get a blow from this side, okay, so blow this from this side, so this bones will move like this, resulting in a forceful abduction. This forceful abduction will cause tearing of the tibial collateral ligament, and we know the tibial collateral ligament has its attachment with that of the medial meniscus. They are attached to each other, right? So when there is a rupture of the tibial collateral ligament, that results in the rupture of the medial meniscus also. So tibial collateral ligament tear often associated with the tear of the medial meniscus, right? This does not happen on the lateral side because we know the fibular collateral ligament, which is on the lateral side is not attached to the lateral meniscus, right? So this is the reason why the tear of the lateral collateral ligament is not associated with the tearing of the lateral meniscus. But on the medial side, because the medial meniscus is attached to the tibial collateral ligament, both structures are usually together, are torn together. All right. So, when is the medial meniscus injured? When the position of the leg is as in kicking off a football. So, football players very often suffer knee injuries, and most commonly it is the tibial collateral ligament and the medial meniscus which are associated. Sometimes, along with these two structures, the anterior cruciate ligament is also torn. So, when all the three structures are torn, it is called the terrible triad.